live?
Live.
All right. Are we live is what we got to know. Dr. Cotter, are you ready?
I'm ready to talk benign, you're fine. Because when it's not cancer, it's benign.
It's not malignant, it's benign, my favorite number in bingo. Benign.
Oh, man.
That's going to be a good day. We have me pirate's chest.
Oh, how are we going to be using this today, Dr. Greenberg?
Well, Dr. Cotter, it'll be very difficult for me to keep in character the whole time. But when people ask a question, they'll be registered to win a prize at the end.
Yeah, so every time someone on Instagram Live or Facebook Live asks a question, we're going to hand this off to our staff behind the scenes, and they're going to drop your handle right in here. And then at the end of the segment, we'll draw a name out, and there'll be a special prize that we'll announce as we're moving along. So,
are you sure?
I believe so.
Okay.
So you can see there's no names in there now. We're going to go ahead and get started.
I just wanted to mention something exciting about the eye patch. It is from Jessica Galindo. Jessica Galindo is a leather artist.
If anyone doesn't speak pirate, that's Jessica Galindo, a leather artist.
And when I move me patch to go below the deck, it leaves me eye dilated so I can see below.
Perfect. That's great.
All right.
Ooh, I already have a question asking, is it for any question?
Hopefully dermatology related.
Yeah, we'd like to stay on topic.
So for benign lesions or anything pirate, we'll do the pirate stuff if we can. I'd just like to say that Dr. Cotter hasn't seen the slides yet.
Yeah, so Dr. Greenberg worked very diligently, very hard on all of the slides we're going to see today. This is your first time seeing them and mine, so I'm going to totally do a Ron Burgundy and just read what's on the prompter, and we'll see how it goes.
I'm super excited. We see a lot of benign lesions in the clinic, and here are a series of things on people's noses, and they want to know, what is it?
Yeah, I think this is a common conversation we have almost every single day. What's this bump? Can it be removed? Is it cancer? Usually the answer is...
Yeah, it's a harmless growth.
A harmless growth. The answer is yes, it can be removed, and no, it's not cancer.
Yes. So trichoepithelioma, this little pearly bump here, that's a biopsy diagnosis. That's not something I ever think of, really. It was a surprise when I found out that's what it was. Excuse me. Intradermal nevus, common, see it every day, but this one looked a little atypical. And fibrous papule of the nose is something that is a super common diagnosis.
Yeah, absolutely. When it's not a nevus and it's not a skin cancer, it's usually a fibrous papule. Although trichoeps are fun little benign growths of the hair follicle. And actually saw a patient the other day that may have multiple trichoeps. So it's something to think about, especially when things don't quite fit the mold.
So here is just before and after. I took this of one of our employees, and this is her nose. And this was the trichoep, and here it is today. I took it in clinic today, and
yeah, it's a great result. A lot of times trichoeps have deeper roots, and they're a little hard to clear. So excellent work.
Right, this one's sort of a red herring. These are periungual fibromas, Keenan's tumors, seen in tuberous sclerosis, harmless growth.
Yeah, absolutely.
But underlying medical condition.
Yeah, so tuberous sclerosis is a surprisingly common genetic condition. It's passed down from parents to children in what's called an autosomal dominant fashion. So that means if you have it, you have a 50% chance of giving it to your kids, but there's also a lot of de novo or new mutations that just arise without a family history. It can cause a variety of different tumors, most particularly CNS tumors. It can cause seizures. Sometimes they can be malignant, and it's an important diagnosis to pick up. I had a patient in the clinic a few months ago for bad acne. He's a teenager diagnosed with autism. Turns out that his bad acne was actually sebaceous adenomas on the face, which are those fibrous papules Dr. Greenberg was talking about. And the young man actually had tuberous sclerosis and not autism, which explained his developmental delay.
One of the most common diagnoses we make in the clinic are dermatofibromas. Harmless, firm dermal nodules have a stellate appearance when you look at them using the dermatoscope.
Mm-hmm. Yeah, no, these are super common. We see them all the time. They're usually a hard, firm bump. Sometimes they're itchy, sometimes they're painful. Usually they arise after a bug bite or an ingrown hair. A few things can be red herrings for dermatofibromas. I mean, I've seen cases of desmoplastic melanoma look like a dermatofibroma. So if anything's really atypical, changing, growing, bleeding, merits a biopsy.
Dermatofibrosarcoma.
Yeah.
Yeah, a lot of it depends on location too, or if it's new. usually when you see a number of these, it's not much to worry about. And on occasion, and anytime somebody tells me that they're really concerned, we always biopsy that.
Absolutely.
Just to make sure that it's okay.
Yeah.
Because even though these all look somewhat benign, that one's really dark with red and brown discoloration, and this one is somewhat ulcerated. So when you see signs of trauma.
And if there's any dermatology residents out there watching, multiple eruptive dermatofibromas is associated with HIV and systemic lupus as well as atopic dermatitis. So board specs.
That's good. Question?
Allison Hirsch 1104 on Instagram states, "Love those shoes."
Oh yeah. So I got Dr. Cotter a pair of the Derm Bros shoes. Seeing as he's half the picture.
Yeah, we're twinning pretty hardcore today, boss.
Yeah, no, it's really good, and yeah, it's a good thing. Neurofibromas. So I have a couple cases of people who have multiple neurofibromas, neurofibromatosis. When they're solitary, like here, sometimes you know that's what it is before you do the biopsy, and other times you're unsure and you have to do the biopsy to determine what it is.
Yeah, absolutely. Common, benign, meaning not cancerous, neural tumor. Sometimes they're painful. That's why they get biopsied. I think I've had 5 cases in the last year of new diagnosis of neurofibromatosis.
Wow.
And people that have come in for skin checks, come in for acne, come in for painful moles. And, that's led to a nice conversation and some additional testing.
Any questions on neurofibromas? Just bundles of nerves under the skin. And you can see here, this person had this was actually a neuroma. But when I nicked it and tried to drain it out, I sent it because I was expecting a cyst. It wasn't a cyst. And I sent it out, and it was a bundle of nerves under the skin.
Lily Kwan on Facebook is asking, what are skin tags?
Ooh, we're going to get to some skin tags and have some great pictures, but they're like speed bumps on your skin.
Yeah, skin tags, they go by a variety of different names. Acrocordons is the technical medical term, and they're really a fibrous polyp. So it's an overgrowth of the connective tissue, kind of in this polypoid silhouette, meaning a little stump and then a balloon on top. And they're very common in the armpits, in the groin, around the neck.
Yep, speed bumps on the road of life. This patient here, I removed a mole on her right nasolabial fold area, and it's a very quick video. She's going to talk about what happened.
Oh, okay.
I'm a patient of Dr. Greenberg's, and I came in because I had a mole right next to my nose that I had my whole life, and I noticed that it was growing, and I decided that it was finally time to get it removed. So I came in with Dr. Greenberg, and when I had it removed, the process was super easy. The healing process took about a week, and there was no pain, and now there's no, well, it's a little sign that there was something there, but I feel a lot better now. Thank you, Dr. Greenberg.
Oh.
So
you made her so happy.
Yeah, a lot of times when you have something like this, you may want it removed because you're worried that it's cancer, or you may want it removed because it's unsightly to you and it bothers you, it affects your self-image, and both are good reasons to remove a mole. That's how I see it, and she was quite pleased. So this one looked like a mole. It was a mole. The other one, the trichoepithelioma, I thought that was a mole. So you can be fooled just by looking, and a lot of times and then sometimes you're not sure. This was a mole, just a regular nevus, intradermal nevus, and that was removed by scissors excision on the eyelid margin. And she was really happy. That bothered her. She could see it in her peripheral vision. So when she was looking out of one side, it got in her way.
I could see how that'd be very annoying.
Mm-hmm. The eye patch isn't going to solve that problem. A couple ways to remove moles. This is from the Regal text, and this is a punch, which is like a hollowed out end of a pen. So you take this hollowed out bit and you core down to the center, and that's good for flat lesions, and it's snipped and then sewn up. And the other, I use a double-edged razor blade. I don't know if you use single or double.
I use what we stock.
Double-edged razor blade. That's usually for domed projections off of the skin. This one I did a biopsy. It turned out to be a congenital nevus. These are all congenital nevi. And I thought it's important to know, usually congenital nevi come up around the time of birth or within the first 2 years.
Yeah. By definition, a congenital nevus is a mole that's present at birth or develops within the first year of life. And they come in a couple different flavors. And really, the way we grade them as dermatologists in terms of risk of skin cancer, specifically melanoma, is based on their size and also based on their extent or their distribution. Small congenital nevi are really nothing to worry about. The ones you worry the most about are these giant kind of bathing trunk nevi. And then the large ones can be concerning, especially if they're along the spinal cord or on the scalp. And then there's newer recommendations now that if you have 2 or more medium congenital sized nevi, that actually those patients should be worked up for something called congenital, neuromelanosis.
Oh, wow.
And so that involves like an MRI and additional testing, so it can be pretty involved. So it's important to get them checked. But the biggest thing is these get a lot of press because they look really dark, they look really atypical. But if a mole's been there their whole life, then it's less likely to be a melanoma.
Yeah, it's probably benign. Question?
I have 2 questions.
Oh, good.
So question number 1 is from Allison Hirsch, 1104 on Instagram, and she asks, if something is growing, does that generally mean it's bad, and should it be removed if it's bad?
Wow.
Well, the second part's really easy. If it's bad, then yeah, it should always be removed.
That's good. That's good.
But something growing doesn't necessarily mean that it's bad. Lots of things can grow. So a couple of hints are if it's growing out of proportion to the patient. So if it's like a little kid and the mole or the bump is growing in proportion to the child, then that's less concerning. But if it's something that's growing rapidly and out of proportion to the patient, that can be a red flag. And then it's up to the dermatologist to kind of figure out what flavor of growth that is. Some things can grow and they're harmless, whereas other things can grow and they're skin cancer.
Sure. And was there another question?
Actually, there's 2 more questions.
Okay.
2 more questions.
Good. Make sure you get the names and we'll put them on register them for the prize.
So, Facebook, Maria Thurman asks 2 questions. She says, can you help me? I have such a low self-esteem. The second question or statement is, I have these lesions on my nose and they've been there for 4 years. I think it may be actinic keratosis.
So, these were the harmless benign lesions on the nose here. Actinic keratoses are red scaly spots that are precancerous, so those are not benign. And they can be frozen off or treated with a cream, or even you're doing a lot of levulan treatments now.
Yeah, I would say certainly we can help you. And I'm sorry to hear that you have low self-esteem. And we'd love to be able to take care of you as our patient and get you feeling a lot better about your skin. Depending on what you have, we'd come up with the right treatment plan for you and get you squared away.
She added in conjunction to that, my nose always has had these clear plugs.
But we'd have to see
It
that.
sounds like something that should be seen in the clinic.
Absolutely. And then I do have a question from Emmy Rodriguez. It says, can I get an appointment? Ever since I started wearing a mask, I've been breaking out.
Oh,
No,
the mask
absolutely.
me.
Yeah. Yeah, we have some very nice soft masks with the Derm Bros logo on them that feel pretty nice. I like them, but mask knee has been a real problem. We actually did a news segment a few months ago when it first became a problem. And we treat it very similar to regular acne, but absolutely come on in, we'll get you squared away, get you on the right stuff, and your skin will be feeling good again.
Yeah, I agree.
I have a comment from Tanada Couture saying, hi, this is a great job.
Aw. We do have some I'm Essential shirts that we're selling from Tanada Couture at the office. So if anybody needs a shirt, they're here. They're available for sale. This is an intradermal nevus. This was in the umbilicus, and I gave a talk at a conference a couple years ago on umbilical growths, and we have a couple coming ahead. But this one, it's just difficult because of the location. And these are the nevus cells within the dermis. That's why it's intradermal. This is the epidermis on top, stratum corneum below. And this is sort of sessile. And that's these are, when we do the biopsies, we always get a picture. And Dr. Cotter and I like to look at those pictures just to make sure that the pathologist has shown that what we've biopsied is what they say it is. So what to look for? These are the ABCDs of melanoma. So if anything's asymmetric with an irregular border and irregular colors, that could be harmful. And then if the diameter is bigger than a pencil eraser, we're worried about that. And if it's evolving or changing over time.
Yeah, that's great. And if the ABCDEs are too much to remember, I like to tell people watch out for something that's bleeding, growing, and changing. Now, in pediatric patients, the ABCDs still apply in the fact that that acronym is useful, but they're actually a different meaning. So in kiddos, you're looking for a skin-colored bleeding bump that's new. So A actually stands for amelanotic, B is a bleeding bump, C is color uniformity, so it's actually something that's one color, and D is de novo, and meaning new, and E is evolving. So ABCDE still, but a slightly different meaning to each of those
I've
letters.
never heard that. That's really cool.
Yeah.
Yeah, I like it. These pictures, so Melanoma Monday this year was, it's the first Monday in May. It was May the 4th be with you this year. And when we were at our American Academy of Dermatology, Dr. Cotter, who's a black belt in Taekwondo, took on Darth Vader and won, except when Darth pulled out the death grip, which...
Yeah, he got me back.
Yeah, they don't have that in Taekwondo.
We don't have a death grip, but I do cut out a lot of melanoma.
It's true. We do see a lot, and I think I probably see 2 a month. Yeah. So if you're concerned about a lesion and it's meeting any of these criteria, or even if you're just worried, it's probably worth getting examined. We rate moles, at least in our training, from a normal mole all the way to melanoma, which isn't really a mole, but it goes mildly abnormal, moderately abnormal, severely abnormal, melanoma in situ, and melanoma. That's the way that I was taught, on a gradient. And I'm just going to take you through some mildly abnormal. And when we look at these things under our dermatoscopes, a lot of times we know that it's abnormal. We're not sure where on the gradient, because you need to have that dermatopathologic diagnosis to state what exactly it is. These are moderately abnormal, and sometimes it's hard to tell, looking at these, what the difference would be. But all of these were atypical enough to require a biopsy.
Yeah, but if we go back and we apply our ABCDs, this is round, it's symmetric, it's uniform in color, homogeneous. It doesn't violate any of the criteria. This one is one color, round, it has a scalloped border, so that's a little abnormal. This round, dark, homogeneous, single color, less than 6 millimeters. But maybe for any one of these patients, even though these aren't violating the ABCDs, if this is the only mole a patient has, that violates something called the ugly duckling rule. Yep. So even if a mole looks normal, but it's the only one like it, and every other mole looks different, then that mole needs to be biopsied because it's stepping out of line.
Yeah, so I call it the signature mole. You sign your name 100 times, it looks the same. If I sign your name once,
yep,
it's going to look different.
Exactly. Do we have any questions?
Yes, we have 3.
Okay.
So I'll get the Spanish ones out of the way because I can tell you those. So Lilia Bernal says, necesito una cita para checar mi lunar, which is like
a mole.
Make an appointment for the mole.
Yeah.
And then she says, ¿tienen alguna especias de servicios de cosméticos? Which is...
We do have cosmetic specials. You'll have to call the office. We have Spanish speakers here.
Perfect. And then Love Lulabelle is asking, why are melanomas often found in areas not exposed to the sun, such as between the toes?
Ooh, interesting question.
So it's an interesting way that you frame the question. It's not that they're more often found, but they can be found there. So melanoma comes in a couple of different flavors. So there's certainly your classic sun-exposed melanoma, and that's a melanoma. The most common area on a man is usually on the trunk. On a woman, it's usually on the calf, which are sun-exposed areas. And there's another type of melanoma called lentigo maligna, which is usually on the face or the scalp of an older person. There's the one you're referring to is called an acrolentiginous melanoma, and that's a melanoma that's on the hands or the feet. And that's actually the most common type of melanoma in African American patients and Asian patients.
Yeah, that's one that killed Bob Marley.
Yeah, it did get Bob Marley because back then
he wouldn't take his toe off.
The treatment was amputation, and that violated Rastafarianism. So he passed away of metastatic melanoma, University of Miami Hospital, because of that. Now, to answer your question as to why, melanomas come in a variety of flavors, and they have different genetic changes. So ones on the hands and the feet, they usually have a mutation in a specific gene called c-KIT, which is also commonly mutated in melanomas of internal surfaces like mucous membranes. You can have melanomas inside of the nose, inside of the vagina, inside of any area that you have melanocytes, which are the cells that make up melanoma. And it has to do with different genetic changes, to answer your question on a molecular level.
I have another question from Sparkle.Steel on Instagram. How common are melanomas in children, and why/how do those occur?
So melanomas in children are very rare, very, very rare. But the thing to balance that is skin cancer in children, the most common skin cancer in a child actually is a melanoma. So in the 1 to 24 year age range, melanoma is the most common skin cancer, even though it is exquisitely rare. And it's usually due to some type of a genetic change and not necessarily driven by sun the way they are in older patients.
Love Lilith said thank you for answering the question. And then Sabrina Sawyer on Facebook said, nice shoes, doctors.
Thank you.
Thanks, Sabrina.
Oh, and then we also have Linda Muscanel on Instagram saying hello to the doctor.
We should let Sabrina know you come and work for us. We got a pair for you. Severely dysplastic nevi. So along with what you said, if you wanted to describe sort of what would make this looking severe to biopsy.
I mean, here you've got at least 3 colors. There's a dark brown, a light brown, and kind of a pinkish white hue there. It's definitely asymmetric, growing out kind of like an island spreading. That's very abnormal. I totally agree with the biopsy. These are the ones that kind of scare me though, right? Because if you go back to your mildly abnormal, and we look at this guy, and then we look at this guy, and we go forward and look at this guy, they're very similar, but this has a few things that are concerning to I think, a dermatologist. This little rim around it is not just red, it's erythema. So there's some inflammation going around the rim of this mole. There's also some superficial scaling, which is an abnormal finding. So those 2 things tell me that the immune system is bothered by this mole. And if the immune system is bothered by the mole, so am I. And that mole's going to get a biopsy.
That's fair.
This one is just ugly. I'm surprised it's not melanoma. I mean, it's
brown with black.
Black in the middle, brown here, a gray veil. The color is asymmetrically pigmented. I know it's hard to see these images now, but in the final cut up on YouTube, we'll have higher resolution photos of the pictures for you guys to see.
These next lesions can be really scary if you're not sure what you're dealing with. And I've been fooled a number of times by blue nevi. They're harmless. Yeah,
they are. So blue nevus, it's called blue because there's such a high density of melanocytes deep down in the skin that it almost gives it a blue hue. They can be blue-black. They commonly show up on the hands, the feet, and the scalp or the head and neck. And that's where the melanocytes migrate during embryogenesis as we're forming. They start off in our spinal cord, the neural crest, and they migrate out. And what happens is sometimes they get stalled, and they get stalled kind of right before they finish the race. It's like mile 25 in the marathon, and they just will accumulate on the tops of the hands, tops of the feet, the head, and the neck, and they can look real scary.
Yeah. This one was interesting. I biopsied it. This is a biopsy diagnosis because you can't tell otherwise. And it's a combined nevus. So it's a compound nevus and a blue nevus combined into one.
Yeah. I've had a couple of those, and I like to explain to patients, it's kind of like, real estate on the coast. It's all about location, location, location. And somebody wants to be in a place bad enough, you're going to build right on top of each other. That's exactly what's happening here. You have 2 different things that are occupying the same space on your skin.
Oh, I like that. I like the description. This is exciting. It's linear melanichia, and it can be a common normal variant in certain ethnic types. And yet, if somebody just has one and doesn't have any other nails with it, it can be really concerning.
Yeah, I probably see a consult for this once or twice a week. And things that I watch out for, Dr. Greenberg, are melaninichia greater than 3 millimeters. So I'll actually break out my dermatoscope, which has a little tiny ruler on it, and I'll measure it. I look for irregularity in the pigment. I look for appearance of the pigment along the skin, back here behind the nail. And just like you said, how many other nails? Is this a young person, an older person? Is it everywhere? And I've been known to biopsy some of the atypical ones before. And usually they're okay, but it's always good to be checked.
Yeah, and here was the biopsy that was done. Took down the proximal nail fold, peeled it back, did a biopsy right before the plate.
Great. And what was it?
It was linear melanichia. Harmless. This is just some comic relief. He's got a suspicious looking mole on his shoulder.
Oh boy.
Any questions where we're at?
We're good.
Okay. These can be concerning. As it turns out, this was harmless. It's a labial lentigo. So it's just a collection of pigment under the
Yeah. The other name is a mucosal melanotic macule, which is just a dark spot on the mucosal lip, and they can be really scary because they can be very dark, and it's a sun-exposed area. If you bite your lip, you can traumatize it, which can change the nature of the pigment within the lesion, making it even harder to diagnose.
This next one was a family member who had dark spots on the backs of the hands. And these are lentigines or lentios or freckles. Well, ephelids are freckles, and lentigines are dark spots that stay and don't go. Freckles come and then they go away. So you can see me lasering here. So we're going to be lasering the backs of the hands. Getting rid of the brown spots. Brown spots on the backs of the hands are typically where a lot of women show their age. Then as well. I've already treated mine. And we're using the Alexandrite laser here, 755 nanometers. The area to heal completely. It'll turn these little brown spots into black spots that can then be wiped off the skin. Of course, if the area is re-exposed to the sun, then the spots will come back. You can do an IPL in this area. We've got a Q-switch laser, carbon dioxide laser to resurface to get rid of some of that crepiness to the back of the hands.
I actually love that second combination that you talked about, using the Q-switch laser, which is a tattoo removal laser, to treat these little brown spots like tattoos, and then immediately afterwards chasing it with a CO2 laser to resurface the area. And it's a really nice treatment done together.
Yeah, it's really good for freckling, discoloration. All right, these are sort of fun. When I look at a skin lesion, I always think, okay, friend or foe. And these are friends. These are, well, you may not want to have a drink with one of them, but these are friends. And they're benign lesions. And this is the benign talk. So waxy brown stuck-on spots. When I see them, I'm happy. High res. This is before and this is after. They can be treated a number of different ways. And they're treated in this way. I use the hypercator just to zap them off.
We have 3. So Valerie_Bugme on Instagram asks, are white or translucent flat lesions moles?
Depends on what it is.
It's a perfect question. So you can certainly have skin-colored moles. You can also have freckle-like lesions that can be white or translucent. And even sometimes a skin cancer, like a basal cell, can appear more white and translucent instead of pink and shiny. It really needs to be seen.
Okay, and then Exotic Baby on Instagram asked, what did you guys study in college to become dermatologists? And in conjunction with that, do you enjoy what you do?
Oh, that's a great question. I'll start, and then I'm sure Dr. Greenberg will have something to say too. But yeah, 15 and a half years ago, 16 years ago, I set out to go to college, and fast forward from that start to 14 years of training later, I was a board certified dermatologist. And so I just started off studying biology. I wanted to be a scientist, and then I went on and got my bio degree. I went and did an MD and a PhD, and then I did an internship for a year, and then I did 3 more years of training in dermatology to get board certified. So it's really a long path, but at the end of it is something that I love doing. I love coming to work every day and seeing my patients and caring for their skin. So it certainly was a long journey, but every step along that way was meaningful and has made me a better doctor today. And I don't think there's anything that can be exchanged for the training of a board certified physician, because going through all of those experiences and having that broad exposure to science and medicine makes you a better doctor, allows you to give the best care to your patients.
It's pretty funny you should ask that question, because I just so happen to have this month's edition of the Dermatologist, which is our journal that all the dermatologists in the country get. And they asked me in a conversation, why did I become a dermatologist? So to your point, and it couldn't have set it up any better. I mean, I don't think we've ever met, but thank you for that. I knew I always wanted to be a doctor after I spent some time with my dad in a cardiac cath lab with my 7th grade friends, and the 7th graders the patient thanked my dad for saving the patient's life in front of all these 7th graders, and it really affected me. And I knew I wanted to be a doctor. And when I told my dad I wanted to be a doctor, he says, you're going to study medicine the rest of your life, so you need to study something different. And I ended up being a history major. And I studied, a Bachelor of Arts in History, wow. And I studied world religions and philosophy. And now I listen a lot to shows like the Jordan Harbinger Show, Mike Rowe, and just like, Dan Carlin's Hardcore History. I listen to different things because when I'm in the room with patients, they may not understand all of the science stuff that we have. I like to talk about some other things that make them feel comfortable. But for me, I had a longer road than Dr. Cotter. We were talking about it today. So, Dr. Cotter, you got your number one choice for dermatology residency?
I was very lucky to do dermatology where I really wanted to, which was at UC San Diego, which was a great experience.
Yeah, and for me, I did a medicine residency at Georgetown before I did dermatology because I didn't rotate through dermatology until my fourth year of med school. I'd already matched at Georgetown to do general medicine, and I applied every year during that medicine residency. I did a year of dermatology research in Madison, Wisconsin, and then I started in Madison and ended up transferring to Texas A&M, Scott and White's system, where I was their first graduate. So do I like what I do? I love what I do. I'm very happy to have Dr. Cotter here. He spent a month with me when he was an internal medicine resident at UNLV, and we just got along great. We're continuing to get along great. It's been a lot of fun, and we take great care of people. Just my brother teases me for being a dermatologist, and yet this morning, I got a message on my page where somebody thanked me for saving her life because she ended up having a melanoma that we sent out. So it's a rewarding field.
Absolutely.
Yeah.
And then the last question, vasanth.kumar.s on Instagram asks, what is the best skin brightening treatment you suggest for dusky skin color? And then I have another question thereafter.
It really depends on the patient's skin type and kind of their medical history, but I have lately really been enjoying a compounded medication that has 4 different ingredients, one of which is a bleaching agent, one of which is a non-bleaching brightening agent, an anti-inflammatory, and an anti-aging, all compounded into one.
Yeah, I like some of the Neocutis products for that.
Also, Exotic Baby replied back to you guys with heart eyes and said that she was born there, so I'm assuming Michigan or somewhere in between. And then
San Diego, Michigan.
Sunflower Girl 585 asks, can I ask questions about syringoma removal?
Syringomas, yeah.
I don't have a picture of a syringoma, but that's a great question. Benign lesion, usually around the eyes.
Yeah, I think the best way to remove syringomas, and remove them is a different question. Usually you want to resurface them. Yeah. And so you'll drop in some metal contact shields, and you'll break out your CO2 laser, and you'll resurface the upper and lower eyelids, which is one of the more common areas to get multiple syringomas. And it'll flatten them out, give you mileage for some time, and then usually you'll need a repeat treatment down the line.
I just wanted to point out, this is using a dermatoscope, and there are some pseudo-horn cysts that are seen in this benign lesion, the seborrheic keratosis. So when I see that, I'm reassured. And that's just something that we do as part of our training. We trained on how to use these scopes to see under the skin. This I thought was so cool. I didn't know what she had. It was this tufted hair piece of skin that was matted down and painful. I numbed it, I removed it, and it was a seborrheic keratosis.
Nice.
And in fact, all these are seborrheic keratoses. On the nipple, which is unusual, I had 2 nipple seborrheic keratoses.
This little white droplet that's coming out of the nipple was a subcare?
Yeah. I was stunned. I know Dr. Cotter's questioning the diagnosis.
Who signed that out?
This one was my favorite story at the time. For 60 years, this woman didn't wash her belly button. And I biopsied it and sent it out. My advice is please wash your belly button, wash all your parts. But when I gave my umbilical mysteries talk, this was right up in there.
That's a good one.
Thank you.
Wow. She was probably so grateful.
I was grateful.
I do have another question from Bonnie Miramontes on Facebook asking, what is the best treatment for seborrheic keratoses?
Oh, man.
So many. It depends, again, on the skin type.
Yeah.
But one of my favorite things to do, irrespective of skin color, is to just numb them up, gently hypercate them, which is an electric needle that extracts heat and fries them. And that's a really nice treatment, no matter what someone's skin type is, because they don't really leave marks.
Yeah. And here it is, exactly like Dr. Cotter was saying.
Is this patient numb?
No.
Wow, very tough.
She's tough.
When they're gone, it'll take 3 to 5 days to heal. It'll be like nothing ever happened. It'll be easy for drug crown and makeup.
That's a great treatment.
Yeah, and
You don't even need any because you won't have to cover these up because they'll be gone.
yeah, and so
You can
see what it looks like as it's healing, and then when it's clear.
You can also gently freeze them with liquid nitrogen. There's also a product that I haven't used too much because I haven't found it necessary, but it's a hyper-concentrated hydrogen peroxide called Escada that kind of melts them away. But
They took it away from us.
Yeah, it's been pulled. I think maybe it didn't sell so well.
Yeah, well, Yeah.
Is that the story?
I think it was just there was a lot going on with it.
Yeah, I just like the bifurcator. It's more cost effective for patients too.
Yeah, I agree. And this is just the seborrheic keratosis from the umbilicus. So yeah, to your point, this is what it was.
Nice.
Yeah. So you can see the hyperpigmentation along these reedy ridges. Oh, sorry, got too excited. This. I didn't know what it was. It was in this right in this upper trench of the ear. It's difficult to get out, and it turns out this was a seborrheic keratosis.
So they were happy to have gone. Their earbuds fit better.
Right? Yeah, you put those in there. So
when it's not malignant, what is it?
My favorite bingo call, Benign.
Wow, look at these arms, man. You've been working out.
Yeah, it's. Oh, I'd like to thank Kim Couture. I've had a number of MMA sessions now.
Yeah, Dr. Greenberg's really been hot on MMA and boxing, and he's been watching a lot more like pop culture television shows in that regard. So every once in a while, he'll be like popping out of a room and he'll yell, "Kumite, Kumite." So that's been one lately. But the big one has really been Cobra Kai. I think he's totally obsessed, and we'd like to make an announcement that for our Derm Bros Halloween special, we'll be doing round 10, a hair loss Halloween special as Cobra Kai in costume.
Yeah, we'll be Cobra Kai.
And there may even be a live treatment that night.
Yeah, we're going to have to do some live.
Yes. Yeah, I think we have a question.
Bonnie Miramontes follows up with a question, what are the causes to seborrheic keratosis?
So, yeah, I mean, there's like a 5-second answer and a 5-minute answer. And so the 5-second answer is breathing. I like to tell people they're like your gift from the universe. And just like a boat going through harbor, the longer you're in harbor, the more barnacles you'll get. And they do run in families. People start collecting them around age 30. Some people will never get one, but many people do get some, and some people get many. The long answer is there are a few genetic mutations that have been linked to seborrheic keratoses, and how those are passed down or how they occur is still a question under a lot of investigation. But someone like this definitely has a genetic predisposition to them.
Yeah. And this was, that's, what is it, the sign of lesser trelot? Yeah, that's...
Hocus pocus.
Yeah, it's when somebody gets eruptive seborrheic keratoses, you think it's going to be cancer.
I think we have another question.
Board's fodder.
Sunflower Girl 585 asks, or states and asks, MMA and boxing, wow, can you share your post-workout skin routine?
Shower.
Showering is good. I support
good.
Showering.
And then moisture. Moisturizer. I like Bioderma by Atoderm. And it's interesting. So yesterday, I went for a run. I boxed. I swam.
Wow.
And then, I washed my hair. I was very happy with it. I even put conditioner in. And I came to the office, and I was told that I was going to get a treatment by hydrofacial on my scalp. It was called Keravive. And so it's a group of growth factors that are infused in the scalp. So they cleansed my scalp with the hydrofacial, and then they infused the Keravive.
That's great.
And then I looked at the tube of filth that was on my hair after having showered and cleansed my scalp, and it was absolutely disgusting. So I think cleaning yourself, you may have to scrub.
So for people that are looking for a nice, quick post-workout cleansing, there's a couple different things that I like to tell my patients to think about. First of all, if you're talking about on the face, that's very different than if you're talking about on the body. And so a lot of my patients, they'll wear tight-fitting clothing for support as they're exercising, and then they'll be plagued with folliculitis or kind of acne-like changes on the buttock, the thighs, sometimes around the breast. So one of the things I say is keep some loose-fitting clothing in your gym bag so you can switch out if you don't have time to shower. And I'll prescribe topical clindamycin wipes, and you can just wipe down that area quickly just to, get an antibacterial thing on there. Then you want to get home later, you want to shower, do your normal routine, moisturize with what you like, and then if you have a medical condition of your skin, then you'll get appropriate prescription medicines from your doctor.
Yeah, I'm a big fan of like the Clindamycin pledgettes, which are these wipes that you can carry in your gym bag, and it's alcohol and clindamycin, which is a topical antibiotic, and that's really nice. And then you see the filth on there.
Yeah, it burns so good, and it just wipes
nicely
off all the gross dark discoloration and sweat and yuck.
Below the tragus here, there was a tumor, and I did a biopsy, and it turned out this was a cylindroma.
Wow, it's very uncommon.
Yeah, so there are the blue balls within the dermis.
Jigsaw puzzle.
Yeah, so sometimes you look at this, if you look from far away, you think, oh my God, is that a basal cell? And then you look close up, and you're like, oh no, that's a cylindroma. So he was quite happy, and I was happy. This was my umbilical and ear mysteries talk.
Oh, wow.
Nevus sebaceous.
So this is what happened after you did this?
No.
It grew right back?
No, it doesn't happen. At least in my hands, they don't come back. This was a different person.
So nevus sebaceous
different location.
They're a special type of birthmark. It's an overgrowth of a few different common cells that are in the skin, particularly ones related to the sebaceous gland. They're usually present at birth. They don't have hair growing within them, so that's a common sign. And they're usually flat and yellow. But then around puberty, they start to overgrow and they become very warty. So when I see a patient with these, especially if they're younger, I usually like to advise them that at some point you're probably going to want it to be removed, because once they start looking warty, if it's on your forehead or your face, that's not something that's going to be so cute. And it's usually easier to cut it out while it's small, while the kid is small. Then it heals better. Usually they do have roots, so I'm impressed that Dr. Greenberg has been able to do this.
I just like to shave them.
I usually cut them off and sew them up.
Yeah. What about syringo cystadenoma papilliferum? Isn't that?
I've had a couple of those grow out of nevus sebaceous, actually, yeah.
This is Dr. Cotter's favorite slide. I did show him this slide.
Oh yeah, this is great.
These are warts. And warts, verruca vulgaris, vulgar meaning common. There's 100 wart types. Type 1 is usually on the hands, right here. And then there's a number of other types, including the type that cause cervical cancer. So
I like this
HPV
one.
Vaccine.
No, that's my favorite.
That's your favorite.
I had one just like that last week.
Well, you look so much better now.
Yeah, and she was really worried if it was going to leave a scar. I said, yeah, but it's not going to. You're not going to have a wart.
Right. So lots of ways to treat warts. These ones I had cut off because I wasn't sure what they were. This is, to me, when I look at it, I think, oh, it's a cutaneous horn. You know, is it a wart? Is it a seborrheic keratosis, actinic keratosis, skin cancer? All of it. So did the biopsy to determine, oh my God, it was a wart.
How do you think they got them there?
I do not know, but that's a good question. They are viruses transmitted by touch. So when you touch somebody who has a wart, you can get the wart.
I always talk to my kiddos. You know, I see a lot of, probably 25% of what I see are pediatrics. And, you know, it's always a tell when a kid has warts on their fingers. If you don't treat them effectively early, when they come back for follow-up, they have warts on their nose.
Yeah, or they bite the warts. And I've seen kids bite the warts off. And that's how I think this guy got his in his mouth. And he's got actually 2 warts right there, you know. So I lasered, I froze the warts today on the lip. But, you know, like I said, a number of ways to treat them, including laser and cryo. More warts, they're just super common, vulgar, common. The hands, eyelid. Molluscum, it's a pox virus. STD in adults, in children, it's common,
Just
like
part of life.
Yeah, different virus, pox virus.
Very easy to treat. Maybe most will resolve on their own with no treatment over the course of months to 1 to 2 years. But generally, by the time people are seeing us in the office, they've been there for a while, they're a little frustrated, and they're easily treated with a little beetle juice. So it's a juice derived from the blister beetle, Lida vesicatoria, and it's called cantharidin, and it actually causes a superficial blister by breaking up the bonds in the skin that hold it together, and then they float up and they go away.
Yeah, and we also sell in the office a product called molluscum RX. It's a topical to irritate the area, and then the body's own immune system recognizes the virus, makes antibodies, and destroys it. Like other viruses in the universe, and I could go on and on about viruses.
We're not going to talk about viruses
but we'll pass on that. Sebaceous hyperplasia, every day. Not a day goes by I don't see sebaceous hyperplasia. Mm-hmm. They're oil glands. They're on the surface of the skin rather than being deep. When oil glands are deep, they feed the hair follicle and let the hairs come out. When they go onto the surface, then they have this orange donut-shaped discoloration.
Exotic Lizzie has a question again, asking, did you ever have a bad day when you couldn't figure out what one of your patients had?
No, I know everything. Of course. If we don't know, we ask for help. You do a biopsy. Sometimes you have to read about it, reach out to colleagues. Mm-hmm. Usually it's interesting because when you get to a certain level, you realize that when you don't know, their other colleagues probably don't know either.
Yeah, I don't think I've had a case in the last 14 months working here that I didn't know what it was. Not to sound arrogant. And there's been times where I've said it could be one of these 3 or 4 things and we have to do a biopsy. Yep. But that's not because I don't know, it's because no one could tell you what that is without doing a biopsy.
Yeah, I had an interesting case of these red papules diffusely located on the arms and legs, and I did a biopsy, and it was papular GA, granuloma
exactly.
annulare. So I sent that photo to Dr. Cotter to see, because I think it's good when you have a difficult case or you're not sure what it is, so that you keep it top of mind.
Absolutely.
First of all, you have everybody laughing at your comment. And then second, we have Jersey Girl 21 on Instagram asking, what is better to do for warts, cryo or laser?
Oh boy.
I think cryo.
think
I'm
so?
sorry. I don't like to
You're
laser
not the laser
warts.
guy.
I've never met a wart that I can't beat with paring it down and doing cryotherapy. And I have this conversation multiple times a week with someone who's been, I've had the freezing. But here's the thing. A lot of people won't take the time to take out a blade and scrape off all of the dead skin. So like a wart like this here, it's hyperkeratotic, it's thick, same for this one. If you just freeze that, you're just gonna torture your patient for months on end because you're not getting down to the root of the wart. You have to remove all of that dead skin on top, and then you freeze what's left at the base. Doing that is highly effective. It just takes more time. Yeah. And you can't bill for both procedures, which is why most people don't do it. But if you do that, it will be more effective. Same thing with laser. If you just laser that without paring it down, you're not gonna be doing any good at all.
Yeah, I'd like a 10 blade.
Sometimes you need a 10 blade. It's kind of like a pirate's machete.
Hey, it is. All right, skin tags. Somebody had asked about skin tags before. Yes, you can use dental floss and tie them off. You can take cuticle scissors and clip them off. A lot of times we have people sign a waiver saying that I think it's a tag, you think it's a tag, we're just going to throw them in the trash. The way I do it is I'll numb these up individually and just snip them with scissors from Germany because they tend to be the sharpest.
Should we announce what our prize is going to be, Dr.
Ooh, the prize. We had an idea for a prize.
Do you want to know, or you want to wait till the end?
We'll keep waiting.
Okay.
We had a couple ideas for what the prize should be. So we'll have people keep asking some questions.
Yeah, so as long as folks are asking questions, your name's going to be dropped in our treasure chest, and we'll draw it at the end and announce the winner of the prize. The pirate will announce the prize. I think we have a question.
You do. Sunflower Girl 585 asks, can you discuss therapeutic treatments for mastocytomas in adults, and does removal result in reappearance in the same location?
Oh, that's a great question. So I've had a few cases of mastocytosis this year. One of the common presentations in kids is an isolated or solitary mastocytoma. So really, you got to start at the beginning. It depends on the state. Usually, if I make a new diagnosis of mastocytosis, or I get a new patient coming in for a consultation who's already been diagnosed, they get a standard workup, which is a full body skin exam. I usually give them a lymph node exam. I feel for their liver and their spleen. And then I also check some standard bloods, blood counts, liver, kidneys, and I measure something called the serum tryptase level, which is a marker of mast cell burden. If that's elevated, it buys you a hem-onc consult and sometimes a bone marrow biopsy. Generally, if you have a solitary or isolated mastocytoma, you probably don't have systemic mastocytosis, which can be very harmful. It's usually an indolent condition. It doesn't need to be cut out. It can sometimes just be left alone. You can treat it with sometimes injectable medicines.
Is that the one you rub it and it's going to flare?
Yeah, it's the Derrier sign. You rub it and then it does something where it releases all the histamine and it turns into this big red wheel.
People hate you.
I had an attending at Rady Children's Hospital in San Diego. She was so funny. You know, if you were the medical student, and I was a resident, I didn't do medical school there, but every once in a while there'd be a med student that would see a patient and say, I think it's a mastocytoma because when I rubbed it, it turned red. And she would get so mad because you only get one shot at the urtication. And she would say, well, what do you expect me to see now? Because you can't do it again.
Right, and you have to do lido, no epi when you do your biopsy on it.
Yeah, you can. There's some tricks, yeah. You can stain it with C-Kit if it's a spindle phenotype, and so you don't actually have to worry about having them urticate. But yeah, all these little tricks. I don't know if that answered your question, but if you have a mastocytoma, come see me. I'll take good care of you.
There was a question from Exotic Baby saying, do you guys let high schoolers shadow you?
I usually do not.
Get in touch with our office manager.
I'll have undergrads sometimes, usually medical students and other residents, but on a case-by-case basis, we may let a high school student come in.
Yeah, it depends. Depends. So talk to the office manager. Just give a call to the office. Skin tag, and what condition is this here, Dr. Cotter?
Oh, well, I think it's something called Acanthosis nigricans because it has this rippled, velvety, hyperpigmented plaque looking like it's on the posterior neck and probably the axilla.
Yep.
And it's really just due to hyperproliferation of the epidermis. So the keratin layer here is much thicker than it should be, and that's what results in the hyperpigmentation.
So this one came in just for her tags, but as I'm looking at them, I said, has anybody ever talked to you about this?
What did you talk to her about?
Well, these can be a sign of an underlying condition such as diabetes or thyroid problems, or it can be seen in obesity.
Yeah. How do you usually like to treat that, Dr. Greenberg?
I'll do a medical workup in terms of just a set of labs to see, CBC is normal, comprehensive metabolic panel, thyroid panel.
Wow, that's great. Very thorough. That's that internal medicine training. I'll usually ask people to see their primary care doctor. And then I'll give them like a retinoid, like Differin, or Retin-A, sometimes Lactin, and a little hydrocortisone to try to help thin out the skin.
I'll use Hydro 35. It's lactic acid and urea combination.
That's good. I love urea.
And Salix.
Nice.
Salicylic acid wash. Okay. This one I thought was cancer, and it was a pilomatricoma. Pilomatricoma is usually seen in kids, and
wow.
Yeah, they're just cysts, harmless. You can see me. I'm wearing yellow here, and there's the camera.
She sees you.
Yes. Poroma. I think these are usually on the feet.
Yeah.
Yeah, this was on the eyelid.
That's a crazy case.
Yeah, so it's unusual location.
This is a poroma too?
Yeah.
Wow. And did you biopsy it because the patient was concerned, or
I didn't.
just looked funny?
It looked awkward.
It is.
It is awkward.
It looks like a weird mole, but I wouldn't have guessed poroma.
Right, both benign. So these are all benign lesions that you're seeing today. There's a condition called excoriation where people come in and they've picked at their skin, and if you pick at anything long enough, it can thicken.
Do you know how many times it takes to thicken the skin, Dr. Greenberg? Exactly how many scratches you have to do to get to the
That's like the
center of a
Tootsie Roll
prurigo?
pop.
It's like the Tootsie Roll in reverse. So there was a colonel, I think in the Army, maybe 50, 60 years ago. You probably couldn't do this study today. And he built a scratcher to answer the question of how many scratches does it take to make a prurigo nodule, or a lichen simplex chronicus plaque. And the answer is 206,000 scratches. So when patients come in, I know that they're miserable and I know that they're tired because this took hundreds of thousands of scratches. So we want to help. We want to give you the right medicines and help calm it down.
Boy, I'm just thinking of that colonel.
Yeah, you couldn't do that study these days.
Wow, that would not pass IRB approval.
206,000 of these.
We're doing 6 studies in our clinic right now currently for psoriasis, for atopic eczema, lichen planus.
Squamous cell cancer.
And we have an IRB, institutional review board, that reviews our studies, make sure that they're ethical, and that would pass the muster.
Yeah.
Glomus tumor?
Oh, it's great. Usually on the kind of the digits, right? But
Yeah.
this is just out there.
Totally harmless. Leiomyoma.
Oh, yeah.
This is a smooth muscle tumor. Harmless.
Usually very painful, though.
Yeah, both on the nipple. And here's our fascinating front desk champion, Steph, doing a screening on somebody. But focal mucinosis, these are odd, and I don't really think of it when I'm doing a biopsy, but I'm always proven, yep, that's what it was.
Yeah.
Just collections of mucin.
Yeah, to one of our
harmless brown
questioners earlier,
substance.
kind of a translucent skin-colored bump. A lot of times they can just be full of mucin, and it's just a random thing that occurs. Sometimes associated with thyroid disease, but usually not.
For the woman who was talking about the syringomas, these are xantholasma. It's different, but sometimes they can appear a little bit similar, at least like this one maybe, which looks like a papule. But here are these plaques of cholesterol deposits.
Yeah. Questions?
I'm not sure as to what these are, but Mia Banks says, I have these all over my body like raised freckles. Can they be lasered off?
Depends on what they are. If they're moles, no. If they're seborrheic keratosis, probably. Maybe not lasered, but treated
burn
in
them
some
off.
other way.
Yeah, it depends. We got to see it. Got to see it. This one I thought was really cool. Hydrocystoma and hydrocele, just fluid filled.
Hydrocele?
Yeah.
Like in the scrotum?
No, not this one. Hydrocystomas. Again, the pearly papules right here. So you were asking pearly translucent papules. These are filled with fluid. This was a cyst, and cysts, some people absolutely love cysts. This is right along the eyelid margin.
Oh, that's
it's
great.
A tiny little milia, and she was, really pleased not to have that there anymore.
Mia Banks also said, is this summer then dermatology? Because I cannot find the name of your place.
Oh, we're Las Vegas Dermatology.
We're Las Vegas Dermatology, LV Derm. Yeah.
Yeah, if you're looking for a dermatologist in Las Vegas, it's a nice unbecoming name, Las Vegas Dermatology. Easy to find, not to be confused with some of the other similar sounding names in town. But LV Derm on Facebook, on Instagram.
Just
on the
search
website.
Derm Bros on YouTube, and that'll take you to our YouTube channel for Las Vegas Dermatology. You can see some of our other videos. This is our 9th one. We talk about lasers all the time in one of them. And
Skin cancer, scars, acne, eczema, psoriasis.
Jersey Girl 121 asks, is it highly recommended to have a cyst removed if you've had it for years already and had no change in it?
That's a personal decision.
So it's, what is this? And we didn't know what it was, and I nicked and drained it, and it turns out this was an epidermal inclusion cyst. Yeah. So you got to see it to know.
I usually tell people if it bothers you, get it cut out. I mean, if you'd be happier without the bump. And there have been times where, just like Dr. Greenberg says, you're not sure what it is, and you cut it out and you're surprised.
Yeah, I had a woman who had 3 cysts. I told her we could biopsy it, biopsied one, and it was metastatic breast cancer.
Yeah, I had a metastatic squamous cell cancer that was, looked like a cyst on the temple. And so, yeah, if it's there, there's no reason to leave it.
Yeah, if it's new, if it's concerning, if it's growing, bleeding, changing.
I think we have 4 minutes left on the live. Is that what you said, Steph?
No, we did it for 6:30, but we'll see what we got.
But the live will only go for an hour.
Yeah.
Oh, really?
Yes.
Okay then. Digital mucus cyst, harmless growth on the finger.
Dr. Greenberg had a lot of benign.
So many slides. I was so excited. Well, we're going to keep going with our talk as it is, and it'll cut off the live. Maybe we restart the live. But the Facebook live should still go, yeah?
I have to restart all of them, but we can if you'd like to.
Oh, the talk is so good. There's so many other important parts.
Facebook, we can restart that one on live.
All right.
You can have the 2 parts, but then Instagram if you don't want to.
Well, I think we should probably announce a winner, though. I mean,
oh my God.
Don't you think, if we only have a few minutes left?
Well, we've got like 4 minutes left. So at this point, we'll announce our winner. It's going to be, hang on.
What's the prize going to be? The Dread Pirate Greenberg?
The Dread Pirate Greenberg is coming back.
As you wish.
Yes, me lady. Let us see.
But before you draw the winner, what should the prize be?
We had talked about doing some skin tags.
Yeah, so...
Or cosmetic lesions, 1 to 15.
So in the clinic, we do cosmetic destruction of benign, non-cancerous lesions. Whatever they are, if they bother you, we can remove them. We usually charge $200 for 15 spots and then $100 for every 15 thereafter. So we thought tonight's would be a fun one to do a free cosmetic destruction of up to 15 lesions, which is a $200 value. Now, the winner may not be eligible for that for whatever reason, or maybe they won't have them. So I think if that's the case, if we draw your name, we can always substitute it for something else of a similar value in the practice.
It sounds good. So let's grab
our treasure chest.
Grab the chest.
I think they're dropping in some last-minute questions. Looks like there's some that are coming in right now.
Yeah. Gabby Hart said, my forehead has been breaking out badly one after another. Help me, or would you help me?
Oh,
I'd love to help you,
lovely
Gabby.
news lady, Gabby Hart.
Come on in. You know we can help.
Whatever you need, Gabby. Bring your crystal mask. We enjoyed your mask.
Love that.
Oh, I love her mask.
All right, here it comes.
All right. Oh, you ready, Dr. Cotter?
I am ready. Yeah, but I hold the chest and you draw it out because you are the pirate. Close your eyes.
Close my one good eye.
Ready?
Okay. Love Lyle Belly on Instagram.
Oh, awesome. Okay.
All right, so make sure to hit LV Derm with a DM and we can coordinate a follow-up with you. And wow, there were a lot of questions today, so that's really exciting.
Yep.
We loved all the participation. I think we'll have to make this more of a regular thing. That's a lot of fun.
It's a lot of fun, and we appreciate you guys watching. I don't know if we want to continue on. There's so much good content. I think we should for the YouTube people, and they can continue to watch. We'll restart the live.
Okay.
And I think that's a good way to do it.
You're the boss. Captain of the ship.
The captain. You're swabbing the decks. All right, digital mucus cyst. I enjoyed this one. A lot of times somebody has a harmless growth on the finger. It's painful, and you nick it, you drain it, and it's like a little gel.
Yeah.
Coming out. Pyogenic granulomas.
Yeah, positive Band-Aid sign here. Positive Band-Aid sign here. Looks like it was covered up, so that's a nice one.
Mm-hmm. These are bleeding papules. People come in, you got to numb them really well, because if you don't, it'll bleed everywhere. Oh yeah, this was so 2020. Yeah, the pumpkin. I know that Halloween's coming up, and that pumpkin's asking the knife to just surprise him or her. And my favorite Crown Royal mask. Hematoma, post-op.
Oh, yeah.
Harmless. Keloids, other harmless growths. In this case, I cut out the keloid. I repaired the earlobe, the defect. We can do earlobe repair in the clinic, which is, harmless. And then larger keloids on the neck can be cut out. Again, harmless growths. Usually I like to pair that with imiquimod or aldera.
Yeah. Sometimes I'll cut them out and send people for radiation therapy if need be.
This gentleman cut out his keloid from a thyroid scar, used imiquimod topical. This is immediately post-op. This is with the imiquimod, and this is a year later.
It's great.
And I know that you're going to be disappointed, Dr. Cotter.
Uh-oh.
That was my last slide.
Oh, I thought you said you had another hour and a half or something.
Apparently I didn't.
Well, cheers to round 9.
Cheers, round 9.
Looking forward to round 10, the Derm Bros Happy Halloween Hair Loss.
I'm ready.
The Happy Halloween Hair Loss Special in Cobra Kai costumes. That should be
Yeah, those
a good
Cobra Kai
time.
costumes are going to be a lot of fun.
And maybe
With
we'll
our
even
geese.
do a live treatment.
Yeah, I think a live treatment would be wonderful.
You know.
I think people would like to see what it's like to have your scalp injected with PRP.
Because when it comes to hair loss, you need to strike first, strike hard, and have no mercy.
No mercy.
No mercy.
And on Facebook, Jennifer Marlin said, "You two are awesome. Thanks for all the great information."
Cheers to that. Thank you very much.
Cheers. Thank you. Derm Bros.
Derm Bros.
Derm Bros. Wow. I can't